Welcome back. With cooler weather coming and the Delta strain of the coronavirus continuing to cause problems, what are doctors expecting this fall in terms of cases of COVID in Connecticut? Dr. Virginia Bieluch is the chief of infectious diseases at the Hospital of Central Connecticut. Doctor, thanks for being with us this morning. We've heard so much about the Delta variant. So where do things stand with that right now?
The vast majority of cases throughout the country are caused by the Delta variant. We know that this variant is more transmissible than some of the prior strains of the virus.
Now, we have heard some experts, Dr. Scott Gottlieb, who's been very outspoken, say that maybe we're coming to the end of the Delta wave. Are you seeing that here? What's the research showing?
Well, locally, we are continuing to see patients admitted to the hospital. We don't know at the time of admission what variant they have, but we're assuming it's the Delta variant in the vast majority of them. The vast majority of the patients that are being admitted to the hospital have not been vaccinated. We see a few people who have been vaccinated, but they tend to be much less ill than the unvaccinated people.
So still possible to get the disease, but hopefully you won't end up hospitalized if you've been vaccinated. Certainly that's an important piece of this. We've heard reports, particularly out of some hospitals down south, of just, back to what we saw back in 2020, no hospital beds available. Are we seeing that in Connecticut at all, or are we doing better with vaccinations and such, and overall our numbers look better?
Well, we're fortunate to live in Connecticut where there is a relatively high vaccination rate. We are still seeing a significant number of people admitted on a daily basis with COVID-19, however. And again, it's predominantly people who haven't been vaccinated. So yes, the hospitals here remain very busy.
Now, we've heard so much talk about booster shots, and you talked about those who weren't vaccinated. Those who were vaccinated are wondering about that. And I know certainly for those who are immunocompromised, that's a big deal to you.
Currently, people who are not, whose immune systems are compromised in any way, are eligible to receive a booster vaccine. This might include people with cancer chemotherapy, people with transplants, people with uncontrolled HIV infection, people who take a lot of steroid medication. So if in doubt, check with your doctor. The reason boosters are recommended in this population is that some of these patients may not have responded as well as people with intact immune systems did to their first one or two shots of the virus. And research has shown that if you get a third dose of the vaccine and you're immunocompromised, you tend to have a higher antibody level.
Now, we've been talking, over the last year and a half, 2 years about vaccines for COVID, but we've been talking flu vaccines for years. So we were wondering, as we head into flu season, as an infectious disease doctor, are you worried that it's a double whammy? Do you want people to remember to go get those flu shots? Maybe they're only thinking COVID. What's your message as we're heading into flu season?
Absolutely. You should be getting a flu shot this year, as you should every year. Last year was a mild flu season, but we were predominantly staying home and wearing masks. This year, with society being more open, we're worried that we may have a more robust influenza season this year. Influenza and COVID-19 can present with very similar symptoms. So once flu season rolls around, we will be evaluating all our patients for both infections when they come in with respiratory complaints.
Now, they are two different infections, so one, I guess, doesn't have any impact on whether you get the other. But for hospitals, we always did stories prior to 2020 about hospitals being very, very busy with flu patients. So is that a concern? You may not be overwhelmed with COVID patients now, but perhaps those beds will start to fill up just with the regular seasonal patients?
Absolutely. That's a huge concern. As long as we have unvaccinated patients for COVID, we're going to stay busy. And when influenza season rolls around, if it's a bad season, we will be even more overwhelmed.
I know a lot of people commented, just obviously anecdotally, not with any of the expertise you have, that, geez, I didn't even get like the tiniest little sniffle last winter, and that's probably because we were all walking around with masks on and staying away from big gatherings. Did the data actually play that out, doctor? You mentioned a mild flu season. The masks, did they just prevent lots of different infections?
Yeah, we think the mask prevented a lot of infections. This summer, as society started to open up, they started to see a lot more respiratory viruses, particularly a virus known as RSV, or respiratory syncytial virus. Especially children were getting more respiratory infections. So yes, the masks did seem to help with a lot of viruses.
You mentioned kids with those infections. What about kids with vaccines? I know that a lot of parents are very eager to get their children vaccinated. They've been vaccinated themselves and want it for their kids. Are we getting closer to that, in your opinion, doctor?
Well, I think we are. I think the pharmaceutical companies are working night and day to try to get these vaccines out for children under the age of 12. And it's good to hear that a lot of people are anxious to get their children vaccinated. We're hopeful that maybe by the end of the fall, there will be widespread vaccinations of children under 12, but we have to wait for the FDA and CDC to make to assess the data and make sure that these vaccines are safe and effective in children.
All right, so just as we wrap up, doctor, what's your advice to people? We've got flu season, we've obviously got COVID, we've got the Delta variant, people are back out and about, as you mentioned. Are there a couple of key things, that if you bumped into a friend and they said, Dr. Bieluch, what should I think about? What are the key things you want people to remember on this Sunday morning?
Get vaccinated for both COVID and influenza. Wear your masks when you're indoors and in crowded areas with people you don't know. Sanitize your hands, avoid crowds, and try to stay healthy.
All right, good advice. Dr. Virginia Bieluch from the Hospital of Central Connecticut, the chief of infectious diseases over there. A lot of good information. I'm sure our viewers are, maybe they were there taking notes on what you were saying. We appreciate you being with us on this Sunday morning.
It was a pleasure to be here.